Hi there, Dr. Virginia Ellis here. Today we're going to talk about oral surgery. We have patients asking us about oral surgery. So please remember to go ahead and put a like on the like button, share if you have someone who'll benefit from this, and subscribe to the channel. We appreciate your support. It helps us grow to help people like you. Okay, so Dr. Ellis, when is a procedure considered oral surgery? Well, a procedure is considered oral surgery when it involves surgery that is dentally related, that involves the mouth, the jaw, the face, and sometimes the neck area, okay? So head and neck, involving the mouth too, that's oral surgery, okay? What are common types of oral surgery and why may they be necessary? Okay, one is called an apicoectomy. I'm gonna bring this here. An apicoectomy means an amputation of maybe a root or part of the root, okay? So that would be necessary when someone has, for example, a root canal, part of it needs to be retreated, but the problem's at the end and it's too complicated to go from the top of the tooth over here, so they'll go over here and treat part of it, take part of it off, okay? Bone grafting, that's when you don't have enough bone to, say, put an implant or maybe do like a bridge in there where they have to, try to design how to look natural. They'll put scaffolding material. The oral surgeon will put scaffolding material so that bone can grow around the bone socket to allow you to have a better result, okay? Corrective jaw surgery. So if you're someone that has like a overbite or an underbite, and you're having trouble with your jaw, you can't eat, or it's just really, it affects the way you look or you breathe, that's corrective jaw surgery. That would be considered oral surgery. Dental implants, as I'm sure you know, dental implants right here, I'm covering it right here, that would be considered oral surgery. Facial trauma, if you have a car accident, a burn, cuts, that's considered oral surgery. TMJ, like the jaw joint disorder, sometimes you have to go in there and do surgery. That's considered oral surgery. Tooth extraction, where you take out teeth, that mainly involved cutting into the gums, taking bone out to get the tooth out. That's oral surgery and stitching. Sleep apnea, so when they have to go in there and correct for obstruction of the airway, like when you're sleeping. Sleep apnea, first of all, is really a disease where the airway gets obstructed when you're sleeping. So sometimes they'll do something with, soft parts of the mouth or the jaw. They'll bring it forward. That's considered oral surgery. Oral pathology, say someone has cancer of the inside of the mouth, that's oral surgery, okay? Wisdom teeth removal, we all know what they are. They're those teeth, when you have teeth way back, you have the first molar, another molar, and then a third one over here, and that's impacted. That would be oral surgery, okay, where you have to cut into the gum because it's underneath, it's stuck underneath the bone socket, it's not coming out, it'll create complications. That's oral surgery. What is maxillofacial surgery? That's another form of surgery, similar. It's surgery where it's basically involving the jaw, the face, the skull, the neck, okay? If you have a car accident, or if you're having to correct a bite where they have to do major surgery in the face, that's oral surgery. What happens during oral surgery? Well, basically, when you have oral surgery, you have a consultation, you get numbed, and there are different kinds of numbing depending on your needs and the situation that you have. You could have just shots, you could have shots of nitrous, the laughing gas, or you can have sleeping, oral sedation, IV sedation where they go in the vein, or general anesthesia, okay? So you go through the anesthesia, they do the surgery, and after they're done with the surgery, you recover, and then you go home and you wait to recover, okay? It can take a couple weeks for that. How should I prepare for oral surgery? Again, you have a consultation first, and depending on your needs and the complication of your case, they're going to tell you what to do. So if you know that you're going to be going under sedation, where they're going to put an IV, a lot of times with sedation, they don't want you to eat for about 8 or 12 hours because they don't want you to choke on, in case you throw up and you vomit, you don't want to do that. So they'll tell you to fast. You'll have to have someone come whenever you are going to have sedation or general anesthesia. They will require you to have someone come with you. You cannot call an Uber, so they won't even see you. So if you're going to have sedation or anesthesia, you're going to have someone come with you, okay? That's one way to prepare. Make sure you get someone to drive you and take you home. Does surgery typically cover the cost of oral surgery? Does insurance usually cover the cost of oral surgery? It depends. Dental insurance can cover, but every plan is different. And what people have to realize is when you have dental insurance, its coverage depends on the contract that the representative from your company that you work for developed, or the agreement that they developed, the contract that they arranged between the company that you work for and the insurance company. That's why when you work for Google, you'll have different package benefits than someone who works for Nordstrom's. Does that make sense? Someone who works for the airlines, like say Delta, will have a different coverage from someone who works for United. Every company is different, and the best way to find out what your coverage will be, especially in oral surgery, is to talk to the dental office, like doing the oral surgery. That's the best way to do it, okay? If insurance will not cover the cost of my oral surgery, is financial assistance available? Yes, there usually is. If you don't have enough, what we can do, and other offices do as well, you could apply for third-party financing. Okay, so that would be something like Care Credit. It's like a health credit card where you pay on a certain arrangement and you don't pay interest. However, if you do miss the scheduled payment, they will charge you quite a bit, just like a regular credit card does. And from what I know about Care Credit is you can even use it for the veterinarian, for the optometrist. It's actually pretty good. Another alternative is, depending on the type of benefits that you have from your employer, you could also use HSA, Health Spending Account, and that will allow you to use that. Nice thing about HSA is that you can roll that over if you don't use all of it in 1 year. If you do a Flex Spending Account, an FSA, you gotta use it that year or you lose it. Okay, so that's something to remember. How can I schedule an appointment to discuss oral surgery? It's very easy. Call me or call the doctor that you're thinking of going to, okay? That's the best way to do it. Go for the consultation. Make sure you take all the x-rays you need to take. And just follow their advice. And anytime you have a question, let the staff know or the doctor. People are here to help you. So just remember, if you have a question, there's a challenge, even if it's budget, time, fear, let the staff know, let the doctor know, let the front desk office person know, and we will work with you. You'd be amazed how far you can get with people's support. All right, if you found this video helpful, just go ahead and put a like, share, and subscribe to the channel. Keep on smiling because I'm here to help you smile. All right, see you at the next video. Bye-bye.